Hello everybody. I don't normally appear with my glasses, but I know sometimes when I don't have them on, I'm frowning and may appear to be glaring, so I'm trying to practice getting past my vanity for ease. Absolute highlight of my week this week has been spending time at our Stomp Conference held in North Lincolnshire with a real focus on local residents with learning disabilities and the work that we are doing to improve lives and care. The time I was there was really focused on sleep, which is such an important issue both for this client group and actually for so many of our client groups. The work that we can do to treat sleep as part of the therapeutic part of the recovery process. I'm not in any way trying to medicalize it. I'm simply acknowledging that it can sometimes be underemphasized in complex environments full of light and noise, where maybe we haven't been able to personalize the exact setting of a bed, which is what I was being shown by the physiotherapy team at that conference. Real emphasis across the South Yorkshire LD Collaborative on Stomp. That's not to exclude North Links at all. A real emphasis as we build our quality and safety plans in thinking about how sleep is part of that recovery process. Now, it's Stoptober in, well, you guessed it, kind of October. I've been asked to do one of my plugs this time for our very excellent quit team who promised me that they regard Scunthorpe as very much part of the enterprise. They're out and about supporting you as colleagues and, of course, our patients and carers. Got some new arrangements around vaping, but we are very much pro-vaping for people looking to quit who have previously been smoking. So all power to the elbow of that team. I've been thinking quite a lot this week about a dreadful report about misogyny, sexism, abuse in surgical services nationally as part of a wider culture of misogyny in healthcare provision. We're blessed at Ardash with a wonderful new women's network, and of course we're instrumental in the South Yorkshire Women's Network. As a board, we will be considering the Sexual Safety Charter that NHS England has just published at our meeting at the end of September, so look out for more details of that. You would expect me to say there is absolutely no place for casual or any other form of misogyny, but I'm well aware that that happens in public service organisations, and none of us can be bystanders to that. We need to be upstanding in calling it out and dealing with it, and I do mean all of us as allies. I'm very conscious there's still a lot of change in our organisation. I can't honestly articulate here that I think that rate of change is going to decrease this side of Christmas. It's so important that we carry on communicating, not just the what, but also the why, and we carry on listening. You know, Barack Obama had that wonderful phrase, I promise to listen to you, especially when we disagree. And inevitably, in some of the changes that happen in a complex healthcare environment across 3 geographies and different traditions, there will be differences of viewpoints. So it's really important that it's clear that there is a listening ear and that there is absolutely compassion for individuals and for complexity within teams in all that we are trying to do. I'm sure that could ring hollow to some individuals. I'm more than happy to engage directly in those conversations as we think through between now and the end of the month our future management structure as part of that genuine and meaningful consultation. There's a really fantastic future for this organisation, building on past successes, but also recognising some of the underlying quality and safety, financial and partnering challenges. I'm just very excited about the future that we have in front of us, but I recognise there's a lot of change for us to work through honestly and with integrity in the intervening period. So thank you so much for bearing with that and working with colleagues who are experiencing that at the present time. Recovery Games on Saturday. I hope to see you there. And if it is wet, well, I guess the colour will run all the more as we get into it. Thanks so much for all that you do.